The following program is brought to you courtesy of a grant provided by the Bank of Princeton.
Good evening. I'm Lew Goldstein, and welcome to another edition of Focus On. Tonight, my guest is Dr. Anita McLean, who is a clinical psychologist in private practice in Princeton. We'll be talking about depression and bipolar disorder and how it affects individuals and what can be done, some resources that individuals can look at. And we'll be talking about some of the symptoms and some of the treatments and how individuals can address this and how families can help individuals address this. As we are in the post-holiday season right now, first of all, I want to wish everybody a happy and healthy New Year. And as we do everything from our New Year's resolutions to committing ourselves to losing weight, to making it a healthier year, hopefully the show will be able to focus on what we can do to make sure that we don't feel isolated for those individuals who may feel that they're depressed or have thoughts about depression or feel that they have something different than everybody else. And there are ways to deal with it, and there are ways to deal with it. But first of all, Dr. McLean, I want to thank you for coming on the show.
Thank you for having me.
Thank you. And before we get to some of the questions, I want to talk a little bit about your background. And basically, right now you're a visiting faculty member at the Graduate School of Applied and Professional Psychology at Rutgers,
That's right.
where you teach and supervise graduate-level psychologists in training. And you work with the Graduate School of Social Work at Rutgers and other agencies across the state providing cultural competency training for mental health clinicians. I know recently you were, for the last 3 years, Director of Counseling and Psychological Services at Princeton University, and you've also provided community workshops on mental health issues, and you've worked with school systems, public libraries, and other organizations to provide training and workshops on mental health and diversity issues. So it is a pleasure having you here and welcoming you to the show tonight.
Thank you very much. I'm happy to be here.
That's great. I guess the first question that we'd really want to talk about is maybe defining, what is depression and how do we define that, and how do we go about identifying, depression?
Right. So like you were saying, we're going to talk about depression and bipolar disorder, and these are both what are called mood disorders. They have to do predominantly with disturbances in mood, and of course we all feel moody some days and up and down in our moods in everyday life. But when we're talking about depression or bipolar disorder, we're talking about persistent mood disturbances. So not your everyday up and down, but so for depression, when a sad mood persists for a long period of time, usually at least 2 weeks, but mostly when we see people, they've been sad for several weeks, maybe even months, sometimes years. And depression is sort of really a cluster of symptoms. So the mood part, the sad mood being the main identifying feature, but often that is accompanied by feelings of hopelessness, feelings of helplessness, sometimes disturbance in sleep. Sometimes people are sleeping too much, sometimes people sleep too little, sometimes they can't fall back to sleep after they wake up in the early morning hours. Sometimes they're overeating, sometimes they're undereating, but basically the idea is that there's a disturbance that is causing these kinds of changes in everyday life. Often people feel sluggish, and I think one of the most common complaints is tiredness. I'm tired. I have a hard time getting out of bed. Even if I pull myself out of bed, then I'm just exhausted. The smallest things make me tired. Right. And then they tend to start losing pleasure in things that were enjoyable in the past, talking to friends, being with their partner, going to movies, playing games, working. Everything seems like it has no meaning. It has lost pleasure. And in addition to that, the cognitive disturbances like difficulty concentrating on work or school tasks or being unable to motivate themselves to do things, to take initiative. And so all of this sort of forms a cluster. And that, when it persists over a period of time, you can imagine it be very debilitating, and we call that depression.
Well, you're talking about some of the signs and symptoms of depression and bipolar disorder. Is there a difference between mood swings?
Right. So in depression, that's what we call unipolar depression, because mostly people are fine, and then there'll be this dip in their mood with all of these associated symptoms. In bipolar disorder, it's bipolar, so like two poles.
Right.
So people can go to the other extreme of depression, so that the body gets completely revved up. And in mania, which is the upper pole of the mood change, people feel euphoric, actually, and not just happy, but in a way uncomfortably happy. And sometimes that is accompanied by feelings of grandeur, even maybe sometimes delirium, or a feeling that you can do anything in the world. It's just anything is possible. I could just fly out of the window and reach the moon. And concomitantly with that, as opposed to depression, the body gets revved up. So people's minds will seem to move very, very quickly, thoughts coming one after the other, and we call them racing thoughts. Or people talk very, very quickly. And sometimes we talk quickly when we're anxious.
Right.
But this is different. This is like they're almost tripping over their words, and people notice them. And the internal experience is like you're climbing the walls, you're agitated, and you are going, you want to just do more. So people tend not to sleep very much during this period of mania. There is often irritability associated with this, impatience, and sometimes people will engage in risky behaviors, sort of not being able to assess the risk. So they may start gambling, spending too much money, having sexual liaisons that they would otherwise not have, all in this very sped up state of mania.
Okay.
And so after the mania comes the crash, and then we go to the other pole, which is the depressive experience. So that's bipolar disorder, which takes you into these ups and downs. And what I've described is sort of intense bipolar disorder, mania, and then severe depression. But people could have not that high of an up and down, but sort of a hypomanic, slightly less than full mania, and not so depressed kind of episode as well. And every other combination of the two in between.
Okay. Does heredity play a factor?
So there are studies that show that people who have a family history of bipolar disorder, schizophrenia, depression, alcoholism, tend to also show vulnerability towards bipolar disorder. The bipolarity is much more of a condition which you are genetically vulnerable. Although depression, there are family studies that show that people who come from families where there is depression, there can be depression manifest in them too, but you can also have depression without having a family history. Usually with bipolar disorder, one can trace back some sort of a family history of a mental illness.
Okay. And when tracing that back, we talk a lot about how individuals, why individuals get depressed, or why individuals have bipolar disorder. An individual can be perfectly normal one day.
Yes.
And then, as you said, there's some trigger that gets the person thinking about something and brings them down.
Right. So that, usually that doesn't happen.
Okay.
So people who are going to manifest at least severe versions of these conditions will have shown some vulnerability before. Depression can definitely be set off by severe stressors in life, job loss, marital separation, loss of a loved one, difficulties in school, chronic stress, illnesses in older people. if one has a vulnerability, then those kinds of stresses can slowly result in a depressive state, because you sort of start to lose the ability to manage and cope with the stress, and then that makes you feel depressed about yourself, and then you can cope even less, and so you can go down a negative spiral like that. With bipolar disorder, the first manic attack can appear to come out of the blue with a stressor.
Right.
But once that episode occurs, one can usually look back and see that there was some vulnerability. Sometimes it's harder to tell than other times, but the ways in which mania presents itself, you can see that that person had a tendency towards highs and lows. Then there'll be a long period of not sleeping, and lack of sleep often precipitates in a vulnerable person a manic episode.
Lack of sleep.
Lack
Yeah.
of sleep. And I think that, I just heard on NPR today that we don't give sleep enough credit to manage our mental health. And sleep is absolutely critical. Regular, good sleep is critical for stress management, for general happiness, but definitely for conditions like depression and bipolar disorder and other mental health issues.
Is there a certain number of hours that you're supposed to sleep that would help you?
Right. So most studies say that 7 to 8 hours of good sleep with enough REM is advocated, but I think when you're sleeping less than 6 hours, you're not recovering from the stresses of life and just general tiredness. And regularity of sleep is also extremely important, so that it isn't like for 5 days you don't sleep and then you sleep 12 hours and make it up, and that averages to 6 hours a night. That doesn't work. It has to be, and the more that people can develop systems where regularly, most nights, they go to bed at a decent time and get enough sleep and wake up rested,
Right.
that is a great, great preventive.
That's good.
Yeah.
Well, we talked a lot about the symptoms,
Yes.
and maybe we can talk a little bit about treatment now,
Yes.
and maybe if we can get into the treatment part and how people know when to seek help.
Right. So I will say that, there's a range and a continuum along which one can experience either depression or bipolar disorder. So there is a difference between our personalities, our families, the way we cope with things, our stressors, and there's a difference in the way we manifest and experience symptoms. So it's across the board, there's a great deal of variation. Not every depressed person looks the same or feels the same. So, small ups and downs in life are normal, and we all have coping mechanisms for that. Friends, family members, relaxation techniques, mindfulness practices, exercise, healthy eating, all of these things help to maintain our mood. But if people feel that their functioning is getting affected in the way that they can't sort of manage the day-to-day activities of life without feeling overwhelmed or sad or distressed, then it's certainly time to seek help. So I would say functionality is a key piece. If you're doing okay, some parts of your life are not going so well, other parts are compensating for the parts that are not going well, and you feel generally okay and you feel generally able to manage life, then good. Of course, therapy is certainly helpful even in those circumstances. But if it really feels like, for the most part, one is not feeling good about life, then one should seek help. And in the most severe situations, if there are ever thoughts of self-harm, or one is turning to alcohol or drugs or other ways of coping that are not healthy, then it is time to seek help.
Okay. Now, in seeking help,
Right.
a lot of people have a stigma attached to seeking help from a therapist.
Right.
And because they figure, I should be able to figure this out by myself.
Right.
I shouldn't need a third person. But does it help to go to a person who is removed from your family and is a third person, sort of like a neutral, who can sit there and talk to you and, provide you, with some resources and discuss the issues that are bottled up inside you.
Right. I think that's exactly right. I think most of us don't want to disclose our private thoughts and feelings to somebody we don't know.
Right.
But therapy is really created to provide a safe space so that we can, in fact, get in touch not only with getting another perspective from a neutral third party, like you said, or somebody who, depression and sort of difficulty in life doesn't come with a manual, right? So we don't all get the steps on how to live this life and we'd be happy. So someone else can certainly help figure that out. And sometimes one needs to just face the things that are coming up ourselves, and therapy can provide this space where we can sit down and think through what's going on for us, what's happening, what do we need in life that we don't have, and how do we put that in place. Therapy is very supportive. I mean, the clinicians are trained to, first of all, know where one lies along a continuum of mental health, but also to aid people moving forward. So there are certain skills that one can learn, there are certain ways of thinking about things, there are certain change in one's perspective, and just help. And actually, there is so much to be said for just sitting with someone who actually cares and is listening and is interested in your welfare.
That's true. Question I want to know is also medications.
Right.
Now, I know you're not, I know you're not a psychiatrist.
I'm not.
But can you just take us through the process about medications that may be available?
Right. So mostly treatment for most mood disorders, depression and bipolar disorder, is a combination treatment. However, if the depression is very mild, one can get away with doing therapy alone. I usually recommend for people that if they are not functioning well enough even to sit with their therapist and learn something different and new and make the changes that they need to, their severity might be such that medication can help, at least for a period of time. So, for depression, there are all kinds of different medications. The most common ones that we hear all the ads on TV for the SSRIs. But there are also older medications that are available, and the best person to determine what would be best for a particular individual is the psychiatrist. And although family physicians can certainly provide medication prescriptions as well, sometimes it's helpful. I would say most times it's useful to get at least one psychiatric consultation, because psychiatrists are specialists in these particular medications, their side effect profiles, and what works with what other meds and so on. For bipolar disorder, especially when manic episodes have occurred, medication is almost essential, because when the mood disturbance occurs, people can end up in very, very risky places, and at that time, therapy will not work in an acute manic episode. So often medication is part of a long-term regime for that particular illness. But in depression, people do take medication for a while. Meds take a while to work, but they work faster than therapy. And then people learn how to manage life differently in therapy, and then they can get off the medication and continue living their life.
Okay. A lot of times, individuals can see another person and say, you know what, that person really needs some help.
Yes.
But the other person doesn't think he or she needs help and resists the help that's being offered. How do you give advice to, say, a family member or a friend who wants to help somebody, but that person's resisting their help? And what strategies can they use to try and convince the person? Maybe convince isn't the right word, but to have the other person see that their behavior really needs to be addressed, and addressed in a positive way, because You can't change the past, you can't
Right.
change the future,
Right.
and every problem has a solution.
Yes.
So how would a person go about trying to get this person to understand that he or she really should go
Right.
and seek some counseling help?
Right. So that's an excellent question, because it is hard to go and seek help and to actually say something is wrong, I need help. That's a really difficult position for all of us to be in. So I think that support and empathy are key. I think that we sometimes get frustrated. You need to go get help, and that obviously doesn't work. People have to be ready to actually engage with the treatment for it to be effective. But one can certainly encourage the person. Sometimes it helps to have someone come with you for the first appointment, because it doesn't feel so scary and so lonely, and so offer to go with them. I would say encouragement and sort of saying, this is how your life, your behavior, your depression, your mood changes are affecting me. It would help me if you could go for help, rather than something is wrong with you, you go for help.
Right.
I think that just being aware of and giving people hope, especially when there's depression, to help people understand that therapy does help, that treatment can help, and helping them to go through websites. And NIMH has wonderful websites. The CDC has very good information online. We know that depression, occurs in at least 9% of the US population. It's a common issue which has good treatment available. There is also the National Alliance for the Mentally Ill, NAMI, New
Right.
Jersey. They have family support systems and group therapy for family members of
Right.
people who are. So they have wonderful ideas as well available on their website, and they're just a phone call away.
And just for those who may not be familiar with the terminology that you just
Right.
used, the CDC is the Center for Disease
Disease
Control
Control.
and Prevention.
Yes.
And
NIMH is National Institutes of Mental Health.
Right.
They provide a lot of money for mental health research, and they have excellent information for the layperson on their website. So that can, sometimes it just takes people reading about that online to get themselves ready and prepared to come to therapy. And I have had a lot of family members bring their partner, their child, their friend. And the college counseling centers that you mentioned I worked at, friends were constantly bringing each other. And it matters when peers tell each other that you can get help.
talking about getting help, we touched a little bit about suicidal thoughts.
Right.
How is suicide related to depression, and why do people feel that there's no way out?
Right.
And that's the only way out, because they feel sometimes that the situation is so bad that
Right.
they can't think of another way out.
Right.
And
Right,
so,
so-
can we talk a little bit about that, because there are ways out that people
Exactly.
may not know about, or resources that are available
Right.
for people.
Right. And that's an excellent and very important question. Hopelessness is part of depression. It's almost a symptom. So when things get so bad and one is trying and trying and trying, and it's impossible to get out of that negative spiral, you feel like giving up. And again, suicidal thoughts can range from, I wish I could just sleep and never wake up, and actually, people don't do anything to hurt themselves, to actually having thoughts of doing something to harm themselves, doing something to kill themselves. So, again, treatment is effective. Treatment is actually over and over again, we have researched this and we know that treatment is effective. So people, if they are alive, we can actually help them. So if one is feeling suicidal or one is not feeling safe, the best thing to do is to go to the nearest emergency room. Or if it's a loved one, you can call 911, and the ambulance arrives and takes the person to the hospital. The hospital then can create a safe place where medication can be started, therapy can be introduced, and it just gives the person a little bit of respite from the difficulties of daily life. And after that, then regular ongoing outpatient treatment can be started for people. So there is help, and I really, really wish for people to know that 911 will come. And if you're calling from a cell phone, make sure it's a local cell phone. Otherwise, 911 in Texas will respond.
Right.
But the landline is a good option, or going to the nearest emergency room to get help is the best option.
Okay. So as far as getting help, we touched a little bit about that and talking about some of the options that we have. What about children?
Right.
Yeah, let's talk a little about children, both children who maybe, for lack of a better word, their parents may be depressed or have
Yes.
bipolar disorder and the effects on them,
Right.
as well as growing up in that type of family.
Right. Well, so let me back up and sort of answer a different question first.
Sure.
Depression and bipolar disorder can also occur in children. And sometimes it's harder to tell whether this is, behavior problems that are being manifest, or the behavior problems are because the child is depressed or having difficulty mental health-wise. And again, it is absolutely critical to get the right diagnosis, right? Because the same symptom can mean a million different things in
Right.
a child versus an adolescent versus an adult. Getting treatment for the sake of your children is, I hope, a good motivator, because it is difficult for children. If your parents are not doing well, just the natural empathy and longing for the parent-child relationship can affect the child. But more than that, if life in the household is depressed, it's very hard for the child to focus on growth, learning, happiness, and those kinds of activities. Plus, it's difficult for the child to learn coping mechanisms that are effective because they're not seeing those coping mechanisms. Again, if people get treatment, the child also learns there is help out there. If I get down ever in my life, I know that I could go get help for it and get better. So getting treatment can be an excellent learning opportunity for the child.
Okay.
But it's a complicated experience, and sometimes when parents are dealing with these symptoms, family therapy as an adjunct to their own individual treatment is recommended, because it helps the family to understand the symptoms, to know what to expect, to respond effectively, and to not sort of feel like it's my fault that my parent is not doing well. I must have done something wrong, which is what children end up feeling.
Right.
This is a tough spot.
Well, as we wrap up the show for today, I just want to, first of all, thank you for coming on, but also try to get in one quick last question for those who may be sitting out there, by themselves, feeling,
Right.
very alone and feeling very, stressed and feeling like they don't have any place to go to. What
Right.
advice would you give them right now?
I would say go to the internet or pick up the phone and call a therapist, a psychologist, a psychiatrist, a clinical social worker. There are plenty of websites. You can read profiles of clinicians and pick somebody you like and go and see them. And if they can't see you right away, they can make referrals, and you can go to community mental health centers. We have the Trinity Counseling Center in town. If the depression or bipolarity is severe, one could contact Princeton House, which is a great resource for alcohol and drug use. There's Corner House. So there are lots of resources at all levels of the economic strata and at all different kinds of disciplines in terms of psychiatry and therapy.
Well, Dr. Anita McLean, thank you very much for coming on today and sharing us, giving us a lot of your wisdom and resources and knowledge, about these very, very important areas. And hopefully those of you who are watching, whether you're watching by yourself or watching with a friend or a family member, and you know of somebody that could benefit from what we just discussed today, please, make that call. Don't feel isolated. Do what's best to help yourself and stay healthy and get healthy. So that is our show for tonight, and I will see you next week on another edition of Focus On. Until then, I'm Lew Goldstein. Stay healthy, stay well, stay active, and have a good night. Thank you.